Latanya here with Healthcare Corner Talk. Today, I just want to bring attention to Medicaid redetermination. I know that's something a lot of us have been hearing about, whether that's on our local news station, local radio station, social media, but it is something that has started in 2023 for the state of Michigan, June specifically, and I imagine that started up in all the other states, as this is a nationwide thing. What I just want to make sure people understand is that you want to get that paperwork filled out as soon as possible. Anything that your department, Health and Human Services, is requesting for you to continue your Medicaid coverage, you want to try to get that back to them as soon as possible. One of the barriers of people even knowing about it is because they haven't updated their contact information with their Department of Health and Human Services. So your phone number, your address, this is how they're going to communicate with you, especially address, because the redetermination letter is sent by mail. It's a letter. So if they do not have your updated address or a good mailing address for you, then you may not receive it, which means you're going to result in losing coverage because you didn't even know that you were due for renewal. So very important, make sure you keep them updated with your contact information, any changes. Another thing that I want to bring attention to is the idea of people saying, well, I probably won't qualify anymore, so I'm not going to apply. You still should apply. It's either yes or no. That's the worst, right? It's either yes or no. You'd be surprised. Some people can retain their coverage, even though they've had changes in their household size, income, whatever that may be. You may still qualify, so still apply, okay? They have different Medicaid programs for persons that is a little bit above the federal poverty line, their income, so you could qualify, because of that. If you have children and it's a family and, your children may be able to retain the Medicaid coverage. So you still want to fill out that paperwork because there are different Medicaid programs. Just to understand that the negative connotation of having Medicaid is for poor people, that's not true. Medicaid is not just for poor people. It is, however, income based, but there's other qualifying factors as well. So if you have a larger, household and, that obviously the money that you make, it begins to look smaller because you have a larger household. So again, just apply. You may qualify still, your children may still get it. So just do that. I know in the state of Michigan, we have a online platform called My Bridges. I imagine other states have something similar to this where persons are able to manage their healthcare benefits online. This is the fastest and easiest way for you to manage your Medicaid benefits or any benefits that you get through the state. So we're in the digital age. Online is the best and fastest way. So if you're able to, it's safe, it's okay, manage your benefits online, register, sign up, because they communicate with you faster through the online platform as opposed to you waiting for a letter that could get lost in the mail. Just so many things that can happen with mail. And again, for my people that's not updating their contact information, that you will never get that letter because it's sent to a incorrect address or an address that you're no longer a resident of. So just keeping that in mind. And just know that health insurance coverage is important and it is expensive, but you don't want to be left without it. They do have other options for people that are no longer eligible for Medicaid through the marketplace. So selecting a plan that best fits your situation and circumstance is what you should do. Of course, not paying for healthcare coverage is ideal. It is an extra expense that we don't want to bear, but unfortunately, that may be the case. So if you did start a new job during the pandemic that offers healthcare coverage, try to sign up with them. Losing your Medicaid coverage is a qualifying event for the most part, but double check with your benefits manager at your job, and it definitely is a qualifying event for marketplace plans. So if that's what you need to do, then that's what you should do. But having health insurance coverage is very important, and just don't want to see anyone left out there. So with that said, I hope you found what I said today helpful for you. If you have any questions, please feel free to DM me. Take care.